Hi, my name is Jamie Tomlinson and I'm from Goodbye Tattoos. Thank you for joining me today on my YouTube channel, and today's conversation is going to be so interesting. I can't wait, I'm so excited. For those of you who are curious about tattoo removal, so laser tattoo removal works with the laser breaking the ink down in the skin, and then it's your body that that flushes the ink out, right? So what we do at Goodbye Tattoos is not just do the treatments, but we want to arm you with all the information that's going to help you get rid of that ink quicker, because that's what you want, right? You want to get your tattoo gone as quick as possible, but you have to help your body to do that. And how can you do that? Well, if you check out my other videos, you'll find that I've spoken to some other experts in the industry, and today I'm so happy to talk to Catharine Baker. Catharine, welcome to my channel. I'm so happy that you're talking to me today.
Thank you, Jamie. I know it's been a really long time. We've been trying to get this session together.
It has, I know. And you're such a busy lady, and we're running our own businesses. So yeah, I'm so happy that we're chatting today.
Same. And I'm really excited because I'm going to get to talk about all my lovely passions, which are nutrition, gut health, and how that's going to impact your skin.
Absolutely, thank you so much. Yes, today's conversation is around nutrition. So if you're very interested in how, what you can do and how nutrition can help you, then stay tuned, because this conversation is going to wow you, I think. So Catharine, first of all, please introduce yourself properly. You're from the UK.
That's
so
right,
please tell us.
two Brits.
Yeah. I'm from the UK too. Oh my God, I love it. But please tell us your background into nutrition, why you do it, why you're so passionate about it.
Yeah, so it's a really long story, Jamie. So I didn't initially train in nutrition. I actually spent 15 years working for one of the world's biggest food manufacturers, which is completely different to what I do now.
What was that?
Of course. I worked for Mars, the big chocolate manufacturer.
No.
Yeah.
Did you get a lot of free chocolate?
A lot of free chocolate. One of my other passions in life.
Oh yes.
So I was actually always been interested in nutrition. When I was about 21, I was diagnosed with a really severe bowel condition called Crohn's disease.
Mm-hmm.
And so I thought I was pretty well educated in good health, good diet, etc., etc. But I was on a lot of medications. I was in a hospital for a long time, for many, many years. And I thought that was it. That was just going to be my lot in life. And I read every nutrition article I could, and I thought I was doing a good job. And then after the birth of my second child, I had a really severe relapse. And that's when I thought, oh, none of this is working anymore. The medications aren't working. I couldn't work. And so I went to see a nutritionist. And to be honest, I was desperate. I didn't think it would, do an awful lot. I thought I was well educated in nutrition. And it literally changed my life. Within weeks and months, I was, back functioning. I was, sort of off the really severe medications. And that really prompted me to quit the corporate job and go back to university. So here I am, many years later, but I did a new degree in clinical nutrition.
Yes.
Here, partly in London, partly in Australia. And now I run a nutrition business that really focuses on gut health. But
Yes.
gut health is kind of it's the foundation of all our health. So
Yes.
when we're talking about gut health, we're not talking about people necessarily with gut conditions.
No.
It's your mental health, it's your hormone health, and it's definitely your skin health, which
which is really important.
Yeah.
And people do say your gut is your second brain, right? So
100%,
you always say follow your gut. If you don't feel something's not right, follow your gut.
There's a reason for the saying, right?
Yeah, exactly. Yeah. So you did your studies in the UK.
Yeah.
And did you then work in nutrition in the UK?
No, we actually moved here just as I was finishing that degree.
Okay.
So it's a very long degree that I ended up having to repeat a lot of
Yes.
to get the Australian qualification. But to be honest, I'm so glad I did, because I think the standard here in Australia has actually been really high, and
That's great.
Yeah, so good.
Yeah.
So good.
Yeah.
I learned a lot here.
Yeah, good. Can I ask you, what's your typical client then? What kind of clients do you see?
Yeah,
And what are their symptoms?
Yeah, that's a really good question. So I see quite a wide variety, but I'd say the typical is mid 40s to mid 50s. Usually female, but not always.
I was just going to ask you.
Yeah, but I think that's generally because women tend to ask for help a bit earlier.
Yeah, okay,
And the male clients I see, do very well, and but the females tend to have just a little bit more going on at certainly that stage of life.
Of course, yes.
And they quite often have autoimmune diseases. So this is things like Crohn's disease or arthritis or rheumatoid arthritis or psoriasis maybe. And that's where that sort of really going back to that root cause and that gut is really important.
Yeah, sure.
And weight's quite often a common thing, but it usually is a symptom of something else. And again, you go back to the gut.
Yeah, absolutely. Yeah. So just a quick question about the women that come and see you, 40 plus. I'm assuming they're going through perimenopause, menopause, and that has an effect on the gut?
Absolutely, and sometimes it's the very early stages and they may not be familiar with that, but we can certainly see that things as you go through their 40s, inflammation starts to rise, things like thyroids and all sorts of things start to go get a bit slower. And you can start to see that certainly in the gut health as well.
Okay. For someone who doesn't know, and I'm going to play ignorance here, what does a nutritionist do?
That's a really good question. So there's a few things that you do. So a lot of it is about understanding where that patient is. Okay. So do they have a medical condition? What's their diet and lifestyle like? Where are they right now? Because you know there are perfect diets out there, but nobody follows a perfect diet. That's not realistic. And I guess I see my role as taking where that client is, thinking where they want to go. Is it a medical condition? Is it optimizing health? Is it protective for the future? You know, what is their goal? And giving them sort of long-term strategies. So this isn't about following a recipe book or a diet plan. It's actually about tweaking what's there at the moment and gradually, step by step, sort of, making those improvements so that they can see real changes, but they can implement them for the long term.
Nice. Okay. So quite often when I get clients in for tattoo removal, they'll ask me how many treatments am I going to need. So I always say to them, look, everyone's different because everyone's immune system is different.
Absolutely.
And so when I teach them that, when we go to the consultation, I talk to them about, tattoo removal works by breaking down the skin, and then your lymphatic system, which is your body's your body's natural sewage system, I like to call it.
That's what I say.
And it's flushing all the toxins out through your liver and kidneys. So the stronger the immune system, the better the process. And things I say are like, never underestimate the power of drinking water, eating healthy, exercise, and getting rest. Now, the question for you is, how in your terms, how does the lymphatic system work, and how does that help flush out the toxins?
Yeah, so I would say you think the lymphatic system is, I'd describe it in the same way. It's your internal sewerage system.
I'm gonna have some water.
Go, yeah, good point. And it's one part of many of your detoxification organs. So when we think of detoxification, it's a bit of a buzzword, to be honest. And it's nothing to do with teas and cleanses and things like that. It really is about things like the liver, the kidneys, the lymphatic system, and also the gut. Going back to the gut. And those systems all work together to bind the waste, to collect it up. To the lymphatic system is like it's like your sewer people going around collecting all the waste. They deposit it in the liver. The liver packages it up, and it needs certain nutrients to make that process really efficient. And then we sort of put it into the gut, and then ideally the gut will get rid of it.
Yes.
We do need quite a lot of nutrients, those processes, particularly when we're asking more of the body. We've got this ink that's broken down, and we're trying to clear it. What we don't want is it being reabsorbed back through any of those processes. So we want everything working beautifully smoothly.
Absolutely. What slows the lymphatic system down?
So things like lack of movement, lack of fluid. It's very like you had the water. It's very, very fluid dependent, movement dependent. But also, again, we need the rest of the processes the rest of the organs to be able to take on that burden. The sewer needs to be processed. Yeah. So this is where we think about the liver, for example. So the liver takes the waste, it packages it up into like a really toxic form, then it attaches it in to make it water soluble, and then it excretes it. But if there's a sort of a part of the system that is not working very well, it just gets backed up, and then you get overloaded, and that excretion doesn't happen.
No, exactly right. And I do say to my clients, the questions we ask them on the forms and the consultation forms, we always ask them, do you smoke or drink? In fact, I had a lady this morning in my clinic, and she smokes every day. So I did say, look, you do realise that is going to slow your process, because
it's just this extra burden, isn't it?
It's extra burden, and it's also, I always say to my clients, then your body doesn't have the detox capacity to then get rid of the ink, so it is going to slow the process down.
And the alcohol's a really interesting one because, as we know, unfortunately, alcohol is it's a genuine toxin to the body. It's poisonous to the body.
Yes.
So the body will, it's very clever. Like it will prioritise getting rid of that alcohol to protect the rest of the body. But that means it deprioritises things like ink removal or just breathing air and plastics that put on our skin.
So true.
So the body's clever, but it can't do it all.
It can't do it all. So internally, we're talking, smoking, drinking, eating bad. Yeah. What about externally?
Yeah, so unfortunately, this is where all the lovely things we want to put on our skin, and this is a really good point about skin health, is that we all do think about what we put on our skin. We don't think about how we nourish it from the inside.
Yes.
So when we put things on our skin, again, we've got to process them.
Yeah.
So heavily fragranced, anything you can smell, anything spray that isn't like a very natural spray. The candles, anything like that, we've got to clear that generally through our liver.
Absolutely. And what about fake tanning as well?
Oh yes, I have teenage daughters. Yes, the fake tan discussion.
Okay.
Yes. So again, it's a chemical.
I talk to my clients about that all the time because your body's your skin is one big organ and it's absorbing all those. It's
our biggest organ.
Yes, our biggest organ. So fake tanning, not a good idea.
Not wouldn't be my choice.
So my next question is, so after someone's come in and had a laser tattoo removal treatment, what are the key things they need to do afterwards to help their body flush that ink out, to get rid of the toxins and skin health? What are the next steps? Someone's had a treatment, what can I give them? What advice can I give them?
So there's probably two sides to that question actually. So the first one is the immediate skin health. So this is where we think about what we can do to support that tissue healing. That I imagine there's inflammation.
And that's so important because, sorry, just to derail from here, the thing I do say to my clients is the whole thing about drinking water, eating healthy, it's not just helping with getting rid of the ink, it's helping their skin heal. So please carry on. Yes.
And the inflammation actually is it's a really good thing. It's a good part of this process because we need the inflammation to stimulate that tissue repair, to stimulate that collagen synthesis. So we don't want long-term chronic inflammation, but in this case we do need a little bit. It sort of revs up the system to try and get things to work properly. Sorry, my desk is beeping at me. It's my desk. It tells me to stand.
Oh, that's great. Okay, should we stand?
Stand.
I love it. Let's do it.
Okay, that's a really good question actually, and I think there's two parts to that question. So the first one is about the skin healing.
Yes.
And as you say, the second part's about that longer term detoxification. So in terms of skin healing, I guess you get some inflammation.
Yes, you get a little bit of redness. We call it pinpoint bleeding or bruising. And one of the things I say to my clients is, when you're drinking lots of water, eating healthy foods, it's not just about, what you put in your body to help the ink get flushed out. It's your skin that needs healing as well. And all that stuff helps with the skin healing.
Absolutely. And our skin's really nutrient hungry, actually. I think that's the thing to think about. And that inflammation is actually, in this case, it's a good thing.
Yes.
We want that little bit of inflammation to prompt that collagen to grow, the tissue to repair.
Yeah.
So we don't want long-term inflammation, and there's some things we can do to help that, but there's some really specific nutrients, I think, for skin, and we want to think about protein. So very trendy at the moment, but protein. So think about your animal proteins in this case are probably a really good choice.
Okay.
They have a lot of collagen in, so your fish, meat, eggs, but also there's non-animal sources, so your beans and your tofu and things like that. But then there's also the healthy fats. So our skin and our cells need a lot of healthy fats to partly for anti-inflammatory, but longer term anti-inflammatory, but also to really stimulate that tissue repair.
Okay.
So these might be things like oily fish, so salmon for example, or mackerel, but also walnuts and flax seeds that really kind of nice, come together nicely. You get that lovely glow that everyone wants. And then you've got your vitamins and your minerals. Skin minerals, I think of ACE. So this is vitamin A, this is orange fruits and vegetables, so pumpkins, carrots, liver, if you can manage it. Lots of people can't, they get squeamish, but there's some good liver supplements. Some people be a bit careful with supplements, but but they are available if you need them. And then vitamin C, so this is citrus, berries, spinach, things like that. And then your vitamin E, which again is your nuts and your seeds, so think about sunflowers, almonds, things like that. So that's kind of a nice combo. And then finding zinc. So zinc is one of those really things that gets forgotten. It's a really important nutrient for your immune system. Don't go supplementing. You can overdose on zinc. It's not a good thing to do. But if you get it through food, it's again your nuts and your seeds. It's seafood, so oysters and lovely things like that.
Nice,
so there's some really so those things sort of go quite well together. You can start to see that there's sort of some similarities in those foods. And they should work together to really protect the skin immediately, but also that long-term health as well.
What are the common misconceptions people have around diet and skin and nutrition that you see amongst your clients, or just in general, really?
Yeah, that's really true, actually. I think there's a really common idea that there's a perfect diet, or one diet fits all. And that is just so not true.
It's so not true.
It's so personalised. And what best for you won't be best for me.
Absolutely,
right? I mean, there's some generic advice, like the advice I give today is pretty well evidence-based, but there's so much nuance in it. So I'd say that's the first thing. And the second thing I'd say is that these really trendy extreme diets they never, in my experience, end well. So when people are really over focusing on a single protein or single nutrient, so maybe it's protein, protein water, protein, everything.
It's not sustainable, is it?
It's not. No. Our body really needs balance.
Yes.
And understanding what that balance is, might take a bit of knowledge or experimenting, one or the other. But those extreme diets very rarely end well, in my experience. And the other thing is the supplements. So people sometimes come to these bags of different supplements. And most things you should be able to get through food. And a couple of carefully chosen supplements, particularly if you're undergoing something like tattoo removal, where your body needs a bit of a boost to asking more of it. That's probably pretty sensible. But understanding what and when and how much and what else is in it.
I was going to say, do you find that some people take supplements for the sake of taking supplements?
I think
they don't really know what they're taking.
I think they hear it on Instagram. That's very common. And sometimes they're pretty good, and sometimes they're not.
So can we talk a little bit more about the gut, please?
Yes, we can. So our gut is home to millions of microbes. I mean, there's a phrase that we are 90% microbe and 10% human, which kind of blows your mind. Right?
That is crazy.
It is crazy. And I think when I do a lot of gut microbiome testing, and what I really see in those patients is that quite often we just haven't got enough microbes. And our microbes are there to keep us healthy. They make all sorts of products and processes and little things for us that support our immune system. They keep our inflammation down. They can help with our metabolism. They keep our gut, making sure that waste goes out and it doesn't get reabsorbed, which is so important when you're thinking about tattoo removal. You don't want that ink sort of being reabsorbed. You want it to go out through your poo, basically. You don't want it coming back into the body.
I do have one question on that. You may have answered this, but I just want to ask it anyway. What would make it reabsorb? That would be all the alcohol and the smoking and the eating unhealthy, fried food and stuff?
A little bit. So there's a phrase that you may have heard called leaky gut. And your gut, meaning your colon, is a little bit like your cheek in your mouth. And you want, you've got all your microbes are inside that colon, and you want the waste to be going out, and really only water should get through that lining. And what we see sometimes is that there's various things, so alcohol be one of them, but lots of other things can happen to make that inside of that gut a little bit leaky. And that's where waste, in some circumstances, can get a bit reabsorbed, it gets into the bloodstream, and then it goes back into the body. But remember, the liver has made it really toxic to sort of package it up, to get rid of it. So you haven't just got the waste that was going around, a few days ago. You've actually got this super concentrated waste that really should just be going out. So that can happen, and that's really worth understanding if your gut is a bit leaky, because that can cause not just skin. Skin's really common, but things like anxiety, mood disorders, hormone disorders. They can be sort of linked, and also autoimmune diseases.
It's so interesting. And I love all this stuff because, like, you know, for me in my profession, gut health isn't just about tattoo removal, it's about your general health. Like, it's so important. Like, it's so
it underpins everything.
It does. So you mentioned that you do gut testing.
That's right.
Okay, so let's talk about that.
Yeah. So I use a test that it's an at-home kit actually. It's an Australian branded kit, and you can just take a pretty discrete sample. Like, it's pretty easy. And pop it back in the post, and it goes to an Australian lab, which is great. And they look at all the different microbes in your gut and what they're doing, and how they impact all your like inflammation or like leaky gut we were just talking about, or are there things that maybe affect your hormones? But also, how resilient is your gut? And I think that's a concept that we don't really think about. You know, we want our gut to be making, or microbes to be making, lots of different things to keep us happy, to keep our immune system really well supported. And we, you know, once you sort of see that some of those microbes might be missing, or you've got this sort of imbalance of different microbes, it can really sort of give us a really clear indication of where to start. Like, where do we go? We're not guessing here.
No, exactly.
The evidence is really clear.
The evidence is there. So then, once you've done this test, do they come back with a recommendation of what you need?
Exactly. So it'll show, you know, what's going on, what we think is driving what. And then as a clinician, you know, I can put that treatment plan together.
Absolutely.
To say,
I was going to say, then your role comes in as a nutritionist.
And it's very rarely, you know, it's never about, you know, take this probiotic and you'll be fine.
Absolutely, no, exactly. It's an ongoing thing, isn't it? Totally. It's a journey, isn't it?
Always a journey.
It's so interesting. So my next question is, like, what's your mission? Like, what do you want to get out of? Like, obviously you love what you do.
Love what I do.
Like, what you've got such a passion about it. So what kind of difference do you want to make?
Yeah, so I always say to people, success for me looks like if you don't have to think about your food day to day, if you don't have to think about your health, that's the goal. Like that, we talk a lot about eating intuitively, but that's actually really hard. Like, you know, to be honest, sometimes eating intuitively is eating the whole box of chocolates.
Oh my God, tell me about it.
But, you know, understanding, you know, where your flex is, understanding how you can kind of just make that, like, enjoy food, enjoy going out for dinner, enjoy whatever you need to do, but not have to overthink about it. That's the goal, and you shouldn't need me long term. No, that's definitely the goal.
You're there to help them, and then they go on their path.
Yeah, exactly.
So, if people want to contact you, how do they contact you? So, for anyone who wants to get more information, any of my clients watching this, if you're not a client but you're still watching this, and you want to get some information, like Australia or worldwide, they can still get in contact.
Yeah, exactly. Right? I work telehealth generally across Australia, so I'm worldwide. So I have a website which I'm passed on to you.
Yeah, we'll put it in the show notes. Perfect. For sure. Yeah.
You know, we can go from there.
So when someone comes to see you, what kind of questions do you ask them about their health and lifestyle?
So a lot of people come to me where they might have a medical condition, or they might have a particular health goal, which may be something like they want to come off some lots of medications, or they're really trying to improve the quality of their life. That's a really common goal. So we'd look at all the holistic factors really. So this is their sleep, their stress, definitely what they're eating, what they're not eating. Patterns of eating. Is it consistent? You know, is it the weekend binge and the you know, eating the week? And I think one of the things that really surprises people actually is about are you eating enough? So I'm really passionate about not restricted diets. It's actually generally about eating more. So people are quite often surprised that I'm not trying to cut this out and cut this out. And certainly things like food intolerance testing is pretty poorly evidenced.
You just want them to eat more of the good stuff.
Yes, that's exactly what I want. But usually there's a reason why they can't, or why they won't, and we know a lot of it is around, you know, because of the coaching and the habit formation is so much part of that. So I like to think I'm a bit of a cheerleader as well, as, you know, kind of like giving you the information, but, you know, let's kind of work out how we're going to get you there as well. So it's a bit of a balance between knowledge and education,
Yeah.
but also that support on the
Yeah,
side.
absolutely. And I do find that maybe generationally people didn't have the knowledge and education. Like my mum and dad didn't. They didn't, obviously, you know. I come from an Indian background, so you know they eat a lot of Indian food,
Great,
and which is delicious.
Yes.
But again, too much of a good thing. You know, it's not. Yeah, it's too much. It's too much glorified.
And I grew up in the 80s in Britain, where you know processed food was just taking off.
Yes.
So it was really fashionable to eat, you know, packaged processed food. And, and I'm really lucky that probably wasn't the mainstay of my diet.
No, yeah.
But you know, look at what my kids now, what I make them eat. And
Yeah,
it's totally different.
yeah. No, but they you know they love that. Their body loves it as well. I always find, and I don't know if you find this, that sometimes if I eat a really nice healthy salad, my body just loves me for it. And I love going to the gym, and I love running, and I find that if I do have that for lunch, I can just run for a little bit longer in the evening. I don't know what it is, it just fuels my body, and I do.
And understanding that fueling is really important. Making sure we're not under eating, making sure we are getting all the nutrients that we need. And just as I say, just making sure that the body's working well, and you don't have to think about it. It's just such a beauty. You know, we talk about food noise a lot.
Yes.
And just removing that food noise so that you can just enjoy and go and live the rest of your life without kind of constantly thinking about what you eat. That is absolutely my goal.
Oh my God, I love this. Thank you so much for talking to me today.
You
have given me so much nuggets of gold, and I'm sure you guys will agree. This conversation has just gone wow. It's so interesting. I'm going to put all the information in the show notes if you need to contact Catharine. Do you have any last words you want to say?
I'd say just don't neglect your gut.
Don't neglect your gut. There you go. Thank you for joining us today, and we'll see you in the next video. Thanks. Bye.
Bye.